BCEN Test Prep Exam Club. Question 1. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A. Administer oxygen. Option B. Place the patient in Trendelenburg position. Option C. Immediately discontinue the procedure. Option D. Assess vital signs. The correct answer is option C. Immediately discontinue the procedure. Question 2. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Question 3. The most effective method to control severe bleeding from an extremity wound is: Option A. Elevation. Option B. Direct pressure. Option C. Pressure point compression. Option D. Ice application. The correct answer is option B. Direct pressure. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is: Option A. Obtain a stat chest X-ray. Option B. A needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. Question 5. A patient with a Le Fort 3 fracture is at highest risk for: Option A. Dental malocclusion. Option B. Airway compromise. Option C. Corneal abrasion. Option D. Temporomandibular joint dysfunction. The correct answer is option B. Airway compromise. Question 6. Ovarian torsion presents with: Option A. Bilateral lower quadrant pain. Option B. A sudden, severe unilateral lower abdominal pain with nausea. Option C. Painless vaginal bleeding. Option D. A fever and purulent discharge. The correct answer is option B. Sudden, severe unilateral lower abdominal pain with nausea. Question 7. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: Option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 8. In a multiple casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: Option A. Green, minor. Option B. Yellow, delayed. Option C. Red, immediate. Option D. Black, deceased/expectant. The correct answer is option C. Red, immediate. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. Meningitis is an inflammation of the: Option A. A brain parenchyma. Option B. Meninges covering the brain and spinal cord. Option C. Peripheral nerves. Option D. A ventricles of the brain. The correct answer is option B. Meninges covering the brain and spinal cord. Question 10. The hallmark sign of compartment syndrome is: Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is option B. Pain out of proportion to the injury. Question 11. A positive Koenig's sign is suggestive of: Option A. A cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Question 12. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Question 13. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 14. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 15. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 16. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Question 17. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 18. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Question 20. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 21. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 22. When receiving a verbal or telephone order in an emergency, the nurse should option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D. Refuse to take verbal orders. The correct answer is option B. Write it down and read it back to the provider for verification. Question 23. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer. Option A. Folic acid. Option B. A vitamin B12. Option C. Thiamine. Option D. Magnesium sulfate. The correct answer is option C. Thiamine. Question 24. The most common cause of airway obstruction in an unconscious patient is option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. Question 25. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A. Application of ice to the bite. Option B. Incising and suctioning the wound. Option C. Application of a tourniquet proximal to the bite. Option D. Administration of antivenom, crotality. The correct answer is option D. Administration of antivenom, crotality.